Hey everyone. First, I want to say happy Occupational Therapy Month to all of our OTs and CODAs out there. Thank you so much for all you do. I know that sometimes you feel misunderstood by your patients and their families, but we want you to know on behalf of the compliance team at Health for Heritage that we really do truly know your value, and we know your patients would be far worse off without you. So thank you for all that you do, and we hope that you feel appreciated this month and throughout the year. Today, though, for the Right Way Wednesday, I wanted to talk a little bit about something that I saw sort of pop up while I was doing some recent audits, and that is documentation of a home exercise program early on in the plan of care. And sometimes that's entirely appropriate. A lot of times, actually, it's a great idea to provide a patient or their family and caregivers with some sort of HEP that can help supplement the skilled services that you're providing and help ensure carryover, help ensure, you know, the patient's safety within the home, especially when you're looking at, say, an outpatient plan of care or even home health, but sometimes even in the SNF too as well. It might be appropriate to provide some sort of supplemental home exercise program or functional maintenance program, so to speak, in addition to the services that we're providing. Say maybe when the therapeutic exercises that we're providing gets repetitive, we want them to continue to do that, but maybe they're no longer skilled. And so we provide them with a list of exercises to do in between therapy sessions, right? That's a great idea. The issue that we see sometimes in the documentation is we aren't adequately showing the distinct and separate nature of that HEP and the skilled services were provided. So we might document something like HEP provided today for upper body exercises. And then we're also documenting that we're doing upper body exercises within the treatment session. So what we have to be able to do is when we're prescribing a home exercise program early on, or even as we're continuing to provide a skilled service, we have to show within the documentation what's different about that, right? What makes our service skilled versus the home exercise program that you're giving them? And then why are we providing that additional home exercise program for them? So what is the functional benefit to that? How is it going to help your plan of care? Really spell it out. So, and really kind of highlight when you're talking about that home exercise program, what exercises did you prescribe? Okay. Um, at what intensity level? Really give some specifics. Don't just say HEP, because chances are, if that claim gets reviewed, that reviewer's not going to see that HEP. So you really want to talk about those specifics in the documentation. Don't assume they're going to know what you mean, right? You want to talk about then that how that's going to supplement your plan of care, how it's going to be different, and how what you're doing in your skilled session is skilled in nature versus something that the patient is doing on their own or the caregivers are going to be doing on their own, right? Hopefully that helps, and hopefully that gets you to sort of think a little bit more about how you're documenting the administration of those HEPs. It's a great idea. It's best practice in a lot of cases. It's not always necessarily indicated, but in a lot of times it's a great idea to do that, to help, again, supplement that plan of care and really get positive outcomes. So if you have any questions about that, please let us know in the comment box below. We really appreciate your time. Thanks again to all of our clinicians out there, especially this month, our OTs and CODAs. We really appreciate you. Thank you for joining me, and have a great Wednesday. Happy documenting.